Today's speaker, Professor Eliza Harper, is an assistant professor in the School of Nursing. Before she joined Ohio University, Professor Harper practiced clinical nursing in Central and Southeastern Ohio with a particular focus on care management, healthcare finance, and community health nursing. Professor Harper teaches courses on clinical judgment and nursing care of populations with a particular focus on family and community and professional practice in nursing. Last summer, this past summer, 2016, she took her Global Health Initiative students to a study abroad program in Botswana. Indeed, many wealth and poverty students and faculty members participated in the campus-wide drive for medical supplies last spring, and she and her students took some of the collected items to Princess Marina Hospital in Harboni. One more time.
Gaborone.
Yeah, the national capital of Botswana. And without further ado, I will let you hear from Professor Eliza Harper.
I have a microphone on. No, I have one.
Oh, you have
Yes, I have one. Thank you everyone for coming, and thanks to Dr. Kim for inviting me to come. This is an honor to talk to everyone about our interprofessional trip to Botswana. This will be the fourth time, I think, I've gone this coming summer. And it is an interprofessional trip, and I have some of the flyers here for our trip, and I can lay them back there. We take nursing, generally the junior and senior year in nursing, and medical students, first, second, we've had fourth year as well. We have had, graduate communication students go along with us doing their research. We've had pre-professional students as well going with us. We can find something for you to do if you want to go. Trust me, we'll find something for you to do. So what I want to do is I want to talk to you really quick about the trip and why this is so important. I want to talk about interprofessional education. As you probably know, nursing and medicine, we have this Richland Avenue, this street in between us. And it's difficult because it's hard to get students to cross that street. And it's no one's fault. It's simply because everyone has their own thing, and both professions are very heavy in not only didactic, but in clinical. So this is one way to immerse everyone in focus on one specific topic. I have several students here with me that accompanied me this past year, and then I will introduce them and then give you a little insight into what our trip was like and allow question and answers from the students. So according to the reason, again, going back to why this is so important, according to the U.S. Census Bureau, 1 in 5 Americans will be 65 and over by 2030. So our population is graying. We're having an older population, so a little more diverse patient population for our students. More than half of Americans are projected to belong to a minority group other than non-Hispanic and white by 2044. So what traditionally you would think of as your patient population is shifting. It's changing. So healthcare professionals have to be prepared because you have to understand the culture, the structural issues that create healthcare problems, and you also have to be prepared to provide the care to someone with different beliefs, understandings, different languages. By 2060, nearly 1 in 5 Americans' total population is expected to be foreign-born. Even though total population growth is projected to slow in the coming decades, minority is expected to rise to 55% in total. So here are the facts from the U.S. Census Bureau, and we need to be preparing for that. The U.S. population, as it becomes more culturally diverse, our healthcare teams have to be able to effectively deliver care that's culturally appropriate for that population. So between nursing and medicine, their accrediting bodies are waking up to this. We're seeing that they're incorporating requirements for cultural competency, cultural awareness, and also interprofessional education. So they're starting to require this of institutions. And we're starting to go even beyond cultural sensitivity and the cultural structures that create issues with healthcare delivery. But what we're also starting to look at is those structural issues around that person. So I hate to think that just because you can say culture and it makes you a different person. When I first traveled to Botswana, I am originally from Southern Ohio. And going there, I realized that it's the same problem, the same people on a different continent. They have the exact same problems I have here, or my family has growing up. It's the structure. It's the environment you are in that creates so many barriers, that creates the norms for you, creates the dietary habits for you. So it's not you as a person. Sometimes it's just where you are. And so having our students go to Botswana also gives them that insight when they go out into the, and I can say Appalachia because I'm from here, I don't have to say Appalachia. So it gives them even an insight and a little more understanding of the populations when they go outside of Athens. Again, it's very much the same regardless of what continent you are on. So why study abroad then? If we have it in our backyard, right? So we're surrounded by Appalachia, poverty. Why? Why leave? It was a recommendation by the American Association of Colleges for meeting the challenge providing health care to diverse populations is global learning. But global learning doesn't mean you go. It doesn't mean you have to hop on a plane, right? Can that be done in a classroom? It can, but is it as effective? Through the environment of shared learning and intellectual inquiry, if you do an interdisciplinary study, and it supports direct engagement, real-world challenges, nurtures communication and collaboration, and it pulls the students together. That immersive learning, by pulling the students together in one spot. They're not texting their friends, they're not leaving to go visit friends or family. They're immersed, and their friends are nurses, nursing physicians, nursing students, medical students, physicians, faculty. So that street is crossed for them. Richland Avenue isn't in the middle anymore. And they're forced to interact with each other. And it's surprising how much they're similar. It's surprising what the give and take can do for each profession. So research shows that dramatic effective changes in students' values and attitudes will affect their cultural competence. And this is that introduction to varying cultures. Staying on this campus and reading about it doesn't work. Doesn't work for everyone. May work for some. But the actual immersion is what gives that wholeness, I think, to the concept. Students in healthcare professions, global health experiences are more likely to become proficient with cultural competencies and have the desire to serve marginalized populations. So, being introduced to a different population on a different continent makes that student a little more likely to go to those marginalized or maybe underserved populations here in the US. So again, same people, different continents. But that immersive experience tends to impact their career decisions. Also, it shows the study abroad, they show increased awareness of obstacles faced in the global setting. as you've seen on earlier slides, our population is becoming more and more international, a more mixed population. If our students are to become the healthcare professionals of the future and care for this population, that knowledge is needed. They need to have a more global perspective, and they need to be able to understand some of the choices that their patients make and how to communicate in the healthcare settings. There's little evidence to support the effectiveness of classroom learning to contribute to cultural competency. So the biggest changes that have been found seem to be from this immersive experience. And I have a few students here with me today. The students, Sarah. Okay, I have Joshua Roberts, who's a senior nursing student here in the front. I have Elena Kaiser, who is also a senior nursing student. Rachel Finch is a junior nursing student. And Sarah's hiding over there. Sarah Bolt is second year, correct, Sarah? Over at Heritage College of Osteopathic Medicine. I wanted them to come along because I wanted them to give you a little perspective. The students that get on the plane to go to Botswana are not the same students that get on the plane to come home. I was very surprised the first time when I saw that change. It takes a while because that street, I mean, it just stays there. But what I would like the students to tell you is, how do you feel this experience enriched your learning experience here on campus? And do you feel that this experience is going to impact who you are as a healthcare professional? Sarah? Yes, if you wouldn't mind.
Thank you. It's just for the camera.
Yep. You didn't tell me this was recorded.
Surprise!
Is it on? Okay. So getting on the plane to go to Botswana, I had some expectations because I had done some research on diseases that are prevalent in the country. I knew about like HIV and a lot of opportunistic infections that came along with HIV. But actually working in the hospitals there, I was very surprised to see a lot of the health problems that we have here in the United States, a lot of cardiovascular disease, a lot of obesity, and they have all of that on top of some of the infectious diseases, which makes the healthcare system even more challenging to manage all of those different diseases. So it was interesting to see my expectations from the medical side of things kind of flip, and we were dealing a lot more with non-communicable diseases that were prevalent over there. Another really big factor in the trip to Botswana was just working with nursing students from OU, which I would never really have that opportunity here in OU, which is weird that you have to travel across the world to work with nursing students. And then also seeing a different style of medicine. Medicine over there is very paternalistic, and it was interesting to see how here it's so much more patient-centered, and it kind of emphasized the importance of including the patient in the healthcare setting. And an extra minute to talk to the patient and educate them on their disease and what they need to do. I'm never going to not have time to spend that extra minute with the patient, which was a really valuable experience, I think, from traveling over there.
Other than spending time with your patient, did you have any other takeaways that you think is going to follow you in your professional career? Do you think it impacts how you're going to work with other healthcare providers?
Yeah, definitely. Definitely, I plan to respect everyone that I work with. Not that I wasn't going to beforehand, but it definitely highlighted that. A lot of physicians take nurses for granted, and seeing the nurses over there, just how understaffed they were and overworked they were, just really respect and be thankful for the healthcare providers that you have here in the States, and from the whole spectrum, from the specialists to the janitors at the hospital, and how important they are to make sure that the healthcare system is functioning properly.
Thank you, Sarah.
Yep.
Thank you. Okay, from nursing, Elena, I'm going to stand up and give them your perspective.
Hi guys. So what Sarah said summed it up pretty good, but I have like a specific example I like to share with you guys. For when I graduate, I really want to specialize in surgical nursing, and in the States here, it's kind of hard to get that opportunity as much. And over there, we were allowed to go to like different operating rooms. And being able to work with the surgeons there in Botswana was really amazing, because it's how they do a certain surgery maybe a little bit different than how they would do it here, and they had to really use their resources wisely, because a lot of the time they didn't have the proper equipment, or they were lacking something that typically over here it was like we wouldn't think of. And it was really interesting, like when we would do IV treatments. Instead of doing like a normal tourniquet, we had to use gloves. So using your resources and being careful what you use in the hospitals here, I'm going to be really like careful with now, and I'm not going to like take advantage of it.
How do you think it impacts your perspective on interprofessional education and how you interact differently when you're out in the field as a nurse?
It's really easy when you're obviously working in the hospital to just be focused on like working with like nursing, because you're always around, but like including your physician is really, really important. Like we're working with the med students, and like the doctors over in Botswana, it was like the nursing students there and like the nurses there, there was always a miscommunication, it seemed. Like the physicians never really like came in and talked to the nursing staff, and there was a lot of complications, I think, with the patient treatment. So here we're going to really focus on like talking to everyone included in the patient care, because it is interdisciplinary. It's not just because like I have that patient doesn't mean my physician is going to be doing a different care plan. We're all working to make this patient's like life a lot better, and hopefully have them leave the hospital far better than they came in.
Thank you, Elena. Don't fight. Who's next? Joshua?
You got to stand here in the middle.
Here's fine.
Okay. All right. What was the question? All right. So I think one of the biggest things that I learned was not to take the resources that you have here for granted. There, you get to see how, what they were saying was understaffed, and how little they have for like tourniquets and stuff like that. So you get the kind of mindset to look around to see what can you use for this, and what you have to help you. You know what I mean? You don't really have that broad focus on the little resources that, I can just go grab it out of the closet or out of the room. The other important thing that I learned was, like everybody was saying, the focus on disciplinary stuff, but not only just working with the different healthcare providers and the different people at the hospital. I think you get the education when you like work more with the community and things like that. You kind of had to find out more about your patient. You had to go talk more to your patient, really, instead of, it's all in the chart, it's all right here, everybody knows this person, and stuff like that. So it was a great experience.
How do you think it has impacted your final year? Do you look at your studies in your final year of nursing, the nursing program here, differently because of your experience this summer?
Yeah, I think so. I think, early in the, nursing school, I kind of look at my studies as one, read the book, get the information, but now I kind of, if I'm not getting the information or something, I always look, maybe there's a different way to come about this approach to, understand something, and stuff like that. Okay. So.
Thank you. And Rachel?
All right. Hi, guys. So yeah, this experience was very life-changing for me. The the rest of the summer was kind of weird, just trying to process it, because I don't know, it was just weird trying to take all of that knowledge and everything that I learned there and apply it to my life here. But it was really cool. It was probably like the best thing I've ever done in my life. I think, like Josh said, just with the resources, that was definitely a big thing. I mean, there was times where we would be asked to give a medication and then the medication just wasn't there. And I don't know, that's just interesting because that is something that wouldn't happen here, and it's very different. And then just like Harper said, with the people just being the same, like it's true, we're all the same. And I think that was a big thing that I learned, just being in a different culture. Like the relationships that we made in Botswana were so amazing with the people there. Like the people are awesome. I don't know, like I love that country. I feel like if you spend any amount of time in a country, you're going to end up loving it just because people are awesome everywhere. But I mean, it definitely affected me a lot. I originally went into nursing school because I wanted to be a midwife, and another junior nursing student and I one day were in labor and delivery, and we saw like 5 live births, and that was just crazy. Like it was so cool. Just new life coming into the world and us being able to help with that. It was just awesome. And I don't know, just my whole experience, I couldn't trade for anything.
So it sounds like it enriched your nursing program as you move forward. Did it impact the way you look at interdisciplinary care of patients? Do you think this is something that you will take along with you?
No, definitely. Just like everybody else said, just communication is a big thing. Even with my clinical here in Ohio, my clinical site is in Gallipolis, and the nurses and the doctors, the communication is just not, it's just not there the way it should be. And us even living with the medical students and just spending so much time with them, we talked so much about the differences. And I mean, with every career, I feel like it applies. People just need to be communicating, even if it's not necessarily the exact same role, because we're all a team, and that's just very important.
Thank you. Thank you. One thing that we did find out, trial and error, we made sure that when we arrived in Botswana, that we separated them into different dorms, because of course, being somewhere new, you go with familiar. As we separated them, there was then again that next level of immersion. It did increase the conversation and the interaction between them. One thing that I want to show you, is exactly where we went. From Columbus, we flew to Atlanta. From Atlanta, it was a 16-hour flight to Johannesburg. And then Johannesburg, it was, about 2 hours from Joburg into Gaborone. So it's quite a distance away. But when they say halfway around the world, there you go, right? Our accommodations, we were staying at the University of Botswana. We learned a lot about the healthcare system and health education. We have a partnership. Ohio University has had a twinning. They're involved in a twinning process with the IHS Institute of Health Sciences in Botswana. And they're working together to create a bachelor's type program that mirrors ours in nursing. But there are 2 education systems. We were staying at the University of Botswana. They have a nursing program, but it is not associated with IHS. So they don't have nursing licensure, nor do they have a system that actually works together. So they have several modes of educating nurses there. But we stay on the campus, and this is a good view of what it looks like. These are the graduate dorms. And within the graduate dorms, there are 5 rooms. So this is where the students lived. You have 1 bedroom around a common room. And as you can see, poor Eliza died right there. It's a culture shock when they go. So now they're moving into an environment where they don't have their smartphones. There's no television, internet, maybe, to an environment where there are roaches and spiders. And that, it takes a couple days for them to move past that. Water. The previous time we went in 14, water was shut off 3 days a week totally to conserve because it's a sub-Saharan country. So they were in water conservation. This year when we went, in 15, we had quite a few days without water. And you were lucky if you had hot water. So all of a sudden the showers didn't matter quite as much. Not everyone washed hair every day. But it was just another part of that immersion. Crazy things that you wouldn't expect here. All of a sudden, shopping was a whole different experience. But then again, we don't have those here either. So, how awesome is that, right? Princess Marina is a government hospital, and that's where the majority of our time was spent. Help me if I forget. An overnight stay at Princess Marina was 5 pula. 10 pula to $1, so 50 cents. I think transportation in an ambulance was maybe 10 pula, so $1. Your admission and your stay at the hospital, while you're there, your medications are included. So you're not billed for all the different medications, and that's one way to have that compliance with care. It's available. It's there. We want you to take your medications. We want you to deal with the HIV, the TB. We want these things dealt with while you're here. And we don't want to deal with different strands. So it is a government hospital. And the supplies are a little limited at times. Their method for dealing with TB, the spread of TB, where we would have reverse airflow rooms, to pull the air outside the building, they open windows and turn fans on. And it's winter there while we're there. But this is how they deal with that issue. And it's successful. It works. You see where the nursing and medicine both here? These are considered hallways. So there are concrete sidewalks in between buildings. And the buildings are wards. So it could be female medical, female surgical, male medical, GYN, whichever. But these are the hallways. In one hospital we visited, have buildings, and this is the hallway. It's on a hillside. So they deal with what they have. They make it work. And the longer our students are there, the more they love it. The more it makes sense to them. The more waste they see here. This is a wheelchair. They actually had some real wheelchairs this year when we were there. So they make do with the supplies that they have. They will use gloves to tie around for a tourniquet. When we were there last year, we saw that they were canceling some surgeries. The reason was because their sterile gloves were being used in the wards to change dressings and care for patients. So our students took all the gloves we could find and gave them to the hospital. So the clean gloves went to the floor and surgery could use the sterile gloves. It's limited. It's limited. Their traction, a bag of water that hangs from the bed to use as traction, which our students found as odd, but how effective is that? Efficient, right? A bag of water, it works. It works. Elena mentioned medications, where our medications here in the States are in machines that use fingerprints to access different medications for different patients. They're in this cart in bottles, and sometimes open bottles. And this, doing medication rounds was an experience. The other thing that went along with this, we found, is that our culture here in the U.S. has become all about electronic medical records. It's computer everything. Here it is not. Here it is not. The patient charts are sheets of paper with holes, and they're tied together with gauze or something to hold the sheets together. My students freak out because they have to write all of this. Everyone in our profession gets so used to clicking little spots within normal limits. Lungs are clear, and you click. And you sort of follow this path, and it guides you. Here, you have a sheet of paper, and you have to write a whole assessment out. When we were, the first week, everyone was upset. This was, I believe, last year or the year before. We're very upset because they didn't know what to write, and they had to keep going back and forth and looking at their patient to be able to write the assessment. But by the end of the rotation, they said, why can't we do that back home? I did such a good assessment of my patient because I had to write it. I wasn't being led by the computer. So there's something to be said for actually sitting down and putting your thoughts on paper and not being guided by electronic medical records. And I think that sort of enhances their skills when they come home. They are hands-on while they are there. You can see they are doing dressings, they're in surgery, they're doing treatments in pediatrics, but they are busy the whole time they are there. They provide patient care, and they work hard. They work hard. We leave by 7:15, 7:30 in the morning, and we're back maybe at 2 when things are starting to slow down. But they're busy the whole time. There are no breaks or lunches in that period of time. We go to different areas and work with children, with at-risk children. We go to Stepping Stones and do a child, like a little kid's hospital, where we'll show them how to feel their pulse or listen to their heart. We'll talk to them about healthy eating, maybe check reflexes, blood pressures. We also go to Camp Hill. We have children with disabilities there. Most of them stay there. And this is such a wonderful interaction for our students to go and spend the day with these children. Now, one of the big things I wanted to talk about today is what you see when our students get there is simply this. You have white coats at one table and you have green scrubs at another. Richland Avenue is right here, people. This is what happens. This is how it starts. But along the way, you start seeing they intermix, and all of a sudden, Richland Avenue gets narrow. That street doesn't become quite a thing anymore. And then they end up like this. Well, maybe not like this, but you get it. By the time they come home, there's hugs and, make sure we meet up. And just, was it last week? Everyone was together again for dinner. So they do these little reunion things. We've had medical students at nursing students penning in graduation. They just go back and forth. And without this, we wouldn't have that. They work as a team, not only with each other, but also with members of the healthcare team in country. You can see here again is in Princess Marina. We have nursing students from University of Botswana who are currently doing their rotations. And it's funny how our students and UB students end up working together on patients. You have a little bit of a language barrier, not a lot, but the culture and the traditions, it helps when the students work together. And we've had them meet at the mall afterwards and Facebook afterwards. This is at University of, it's at Baylor Children's Hospital. It's their center of excellence in Botswana for HIV/AIDS. And we spent a day there. And of course you can see the nurses copying an attitude in surgery, right? The other thing to bring these students together, I mentioned that we noticed things like there were no gloves. We pick a project every year, and I think Dr. Kim had sort of alluded to this. We pick a project each year. So the students that were there this year will identify a need for us to address for next year. So I don't have the picture here, but the first year we went, we were in pediatrics and there were no pillows anywhere. And I asked about this. And I was shown a room that had pillows stacked clear to the ceiling. Clean pillows, no pillowcases. But because they had no pillowcases, the pillows weren't used. So this campus got together and collected 475 pillowcases, along with over 300 coloring books and crayons. And our suitcases were full. But we gave back. We filled that need, and everyone pulled together to do that. This is when we figured out that surgeries were being impacted. The medical students rounded up the gloves and any supplies we had and took them to donate. We give back. We don't just go and take, but when we go and we give back. Because again, that's our family just on a different continent. All the same. So as you can see, here, pillows stacked. But we had tables of pillowcases. This year, last year it was identified that all of the scrubs in surgery, one reason why the students weren't invited on a regular basis to go to surgery was because they had very few scrubs. And what they had were full of holes. And I have to say, this is one of my best favorite pictures with the Jodhpur look here. So what they did, they're wearing the same color as nursing students. Last year's class donated their scrubs when they left. And there were probably close to 200 pair of scrubs that were taken and donated. They were so happy that even though our students had worn them for 4 years, you can see what condition theirs were in. The other thing we did, we talked to the head matron of surgery, and we compiled a list of things that they needed in surgery because they were having a lot of trouble with just basic supplies. I believe it was Elena and Danny met me over at over by HCOM. Dr. Drosick has tons of surgical supplies he had from a previous trip and donated retractors and a pulse oximetry machine to check oxygen level and mesh, abdominal mesh, things that they could not get. It takes weeks or months to get this stuff. And it's so expensive. This list is everything we took with us. And this is just some of the things that we took. And our students are very involved. They're the ones behind this. I may find the list, but these students, if you could see them in the airport, there are suitcases everywhere because we can only take so much weight, and they're shuffling supplies all over. So everyone's suitcases are maxed out so we can take as much as we can with us. They learn to work collaboratively from the time they sign up for this trip and are accepted, they start hearing about this project. What do we need to collect? And we start talking. And as you can see here, not only do you have nursing and medicine, but this guy, I believe, was from Russia, and this guy was from Scandinavia someplace. So our students, we're bobcats everywhere. We just pull everyone into it, right? They get a little crazy sometimes. They make new friends. Lots of new friends. They learn all about TB, HIV, diseases that we just don't even think about because they are not prevalent in our society. But they are there. And because we don't think about them here, and it doesn't happen to us, right? It's on the rise. HIV is on the rise again. So we need to pay attention. And you need to know where the coughing spot is, or where you wait to cough. No laughing? I thought this was cute. They learn about Botswana culture, so just being there isn't enough. You need to understand who these people are and why they're doing what they do. We visited the cultural village, and then safari is always a high point for our students. They have time to bond because, again, it's winter. The trucks are open and it can get very cold. Do you see your daughter? Do you see Rosa here? And of course, bobcat pride comes out wherever you go, right? We enjoy our dining in the morning and candlelit dinners at night. They have chefs that cook over an open flame. They bake bread and make every meal there on safari, miles away from any of our conveniences. And once in a while you have visitors for breakfast. They do come into your campsite. Lovely animals with spots. That's Jeffrey over there. Some ugly. And some that have big appetites. And yes, we were that close. And they're just some beautiful animals. So we learn to respect not only the people of Botswana and the needs and the healthcare delivery in Botswana, but their traditions and their land. They go for the experience of the culture, but they come back with so much more. It's not a vacation, it's a growth experience. And they never want to leave. They move past the fact there's no water and there are bugs, and they never want to come back. They're always complaining when they leave. Any questions for my esteemed panel?
So this question is for the students who participated. So aside the opportunity that you had to have hands-on experience and also compare your upgrade with medical facilities with the ones from Botswana, an African country, how does this thing really impact you? If I'm from Botswana and I walk into a hospital today and I meet you as my care provider, how will this experience impact you to help me differently?
Well, I think being around here and doing your clinicals in Ohio and the States, you don't really get that much of exposure to other cultures. So you kind of get in that rut of, okay, these are the norms that you have to go by. But there are so many other cultural aspects that you have to incorporate in your care to not only treat the disease that person has, but also improve the whole, the healthy aspect of that person's life.
Anyone else would like to weigh in? I think this experience, and if I understood your question, you're asking, being a Botswana here, if they were to care for you in a hospital here, how would your care differ now that they've been there?
Besides, just knowing the difference between the two healthcare systems, I think this is something that I was expecting, right? And also getting to do hands-on experience work as opposed to grasping the field.
Sarah, would you like to?
I think one important thing was the greetings in Botswana and being able to greet people before you start talking about medicine, and that's very cultural there. So if I was treating a patient that was from Botswana here in the States, I would make sure that I was greeting them properly. But also just, it emphasized the individual, like a person's a person anywhere you go, like even though they're from some country that you've never been to, and it seems so foreign, they're still a human being, and they still have the same thoughts and fears and anxieties about their medical care that you would as a person. So I just taking that into account.
I think what it does, Sarah's right, and it's Botswana, I'm sorry. What Sarah's right, and I think what the students start to see is not just the individual, but you are a product of that environment, and everyone is that same mix. I mean, everyone, they have to approach people individually, and you're not just a patient there. It's who you are and what your specific needs are. Did we answer your question? Sure. Okay.
One more that
Let's have fresh balls here.
In the back?
Yeah, my name is Norbert Farah, secondary student in African Studies. I heard you mentioning that same problems have been diagnosed here like in Botswana. So basically the same issue in the country. So were you expecting to encounter the same problem? And if so, what did you bring to the table? What did you propose?
What I was expecting, I was asked to create some literature, some study guides for HIV, AIDS, look at cultural aspects and how, as far as greetings and simple language. I wasn't really sure what to expect. And it's not the disease processes I saw that made me feel at home. It was the distance from a hospital, the access to care. It was the doing with what you have. It was the family attitude of caring for each other. I think it was not so much the healthcare system or the disease processes, it was the people that made me realize you have the same issues of paying for health care, finding health care, and accessing the physicians, being able to communicate with the physicians, same issues we have here. So again, I wasn't sure what to expect, but it felt very familiar.
I want to hear what's the long-term effect of this trip to Botswana, in the context of Botswana, for the residents here. For Botswana, what's the gain for Botswana? What's the gain for Botswana? What do they benefit?
The gain?
What
Okay, the gain for Botswana. We are all, Ohio University College of Health Science and Professions has been in this relationship since the 1970s. This trip, what we try to do again is we try to give back and supply some of those medical things that they need. But I think the other thing we bring with us is access to different ways of thinking. I think putting our students with their students, you have that discussion between the students of ways they're taught in the healthcare system. It enriches not only our students, but also theirs. And I think coming from peers is a very positive thing. I think that partnership and we also do a research symposium there. Dr. Gillian Ice goes with a lot of physicians or a lot of professors from the medical college. And they do research symposiums every year. And that encourages that academia there and to build their own base of knowledge and their own expertise with such things. So I think we bring a lot of tools. We don't go to fix the system. We don't go as champions to change things. You know, we go to learn and we go to partner. And so we try to meet whatever needs they have or requests that they have that we can work with them with. We don't want to go fix something. We want to help them and enable them to move forward on their own. Did I answer that?
This was interesting, very nice as well. So I'm kind of thinking about a couple of things, including what is long-term gain for Botswana. Why are we doing this as a university? Why are we doing this as Westerners? What is the contribution of Africans in this big question? So there is a bigger debate going on about aid and collaboration and so on. So I'm thinking about this project particularly with Harper and Botswana in a positive way, that it is kind of based on respect and equal partnerships, partly because I work here and partly because I know the people who run the project. I have a question. I was intrigued by, this is a background. This is happening in Botswana, and Botswana is on the top list of, most stable African countries. They have, relatively speaking, money, plenty of money. It's a rich country. The population is very huge. But some of you were taking, goodies from America, like gloves and so on and so forth. Did you talk to the medical doctors, the hospital administration, why the Botswana government was not able to pay really for the infrastructure? They have plenty of money.
Oh, I just think from what my understanding, I did talk to the administrator, and from my understanding that the money wasn't there for the hospital. It wasn't allocated to the government hospitals. So they were just charged to do with what they had. The other side of it is when we delivered the gloves to them, all supplies go into the pharmacy, and that's the central place for everything to go, and then it is sent out to whatever department needs it. That way things aren't squandered or walked away with. They were currently on the telephone trying to find gloves, but they're just not available. So there's another issue. We did a health screening out in one of the villages outside of the city, and we were trying to do blood sugars because they're non-communicable diseases. As their lifestyle starts to look a little more like Western lifestyle, they start to have the same issues that we do here: obesity, hypertension, heart disease. And we were looking for strips for machines to do blood sugars, and they're just not there. So not only is the funding not really readily available, why, I'm not sure, but then if you want to purchase, where do you get it?
Can you ask them next time we go?
Pardon?
Can you ask them next time we go?
Yes.
Because this country is rich.
Yes, where is it?
Yeah.
Yeah.
Where is it?
According to the administrator, it wasn't being given to the hospital. But that's a good question. I'll ask again. Yes.
At the beginning of your presentation, you talked about U.S. Census population change, and at the end, you talked about tuberculosis. So here, I'm an urban geographer, so American cities, the U.S. and particularly large cities in the U.S. are receiving more and more immigrants from the poorest parts of the world, including tropical parts. So indeed, those immigrant populations are offering American health professionals and students great opportunities to get familiar with the tropical disease or so-called other disease in other bodies, such as heart lung disease. But now we are a lot more familiar with that, so that's a good thing. So same thing that now students in nursing school or medical students go out to Africa, Asia, or Latin America, and it's rather study abroad program. It's actually help or end whatever health problem in those countries. It's rather for educational opportunity for our students. So then it's kind of we may never, within the next 10 years, can we really develop vaccines or cures for those tropical diseases? We may not, but still we are kind of a step closer to those. And what do we need is at the moment, I think we need some sort of expertise, because we do not have many experts on those tropical disease and others. So in my case, I did research on Ebola crisis in 2014, and there it was so obvious that a lot of people and even medical experts just assume that Ebola, that's another part of the world, their problem and others' problem, and it never comes to us. And then once we have some patients here in the U.S., Dallas and New York City, then that's the first time for us to talk about vaccines or any cures for those infectious diseases. So I think it's good thing that it's easy to talk about global health or one world, one health, but it's that kind of connections and expertise, more innovations. So that's going to be a take step forward, closer to that. So, questions? Anyone else? It was a great opportunity for us, African studies, nursing school, and some other mercy and poverty people. 3 groups of people get together and share some experience. And thanks a lot for sharing your study abroad program experience with others.
Thank you very much.